Hi everyone, we're here to talk about the Kingdom of Tonga. Officially, the Kingdom of Tonga is a Polynesian sovereign state consisting of 177 islands with a total surface area of about 750 square kilometers. 70% of Tongans reside on the main island of Tonga Tapu. Tonga became known as the Friendly Islands, according to Captain James Cook on his first visit there in 1773. Tonga has never lost its sovereignty to a foreign power, and in 2010, the country took a decisive step towards becoming a fully functioning constitutional monarchy. Goal number 1. Eradicate extreme poverty and hunger. Target 1A. Halve the proportion of people whose income is less than $1. Target 1B. Achieve full and productive employment and decent work for all, including women and children. Target 1C. Halve the proportion of people who suffer from hunger between 1990 and 2015. Scorecard. Target is generally on track. It is well recognized in the international community that Tonga does not suffer from extreme poverty, since everyone has access to food and shelter. Hardship due to limited access to markets, poorly maintained or lack of rural roads, inadequate medical supplies and trained staff, and the high cost of water tanks, educational services was believed to hinder the people of Tonga from raising their standard of living. From the ADB study, most people have received improvement in their situation. There's been an increase in the number of permanent homes built, improved services, availability of skills training for women and youth, and better living conditions because of money earned from commercial farming. The key factors for strategic planning are tourism, agriculture, and fisheries. Goal number 2. Achieve universal primary education. Target 2A. Ensure that by 2015, children everywhere, boys and girls alike, will be able to complete a full course of primary schooling education. Scorecard. Target is on track. Since 1962, Tonga has ensured that primary education is compulsory and free until Class 6. It is recognized that the quality of education, even at the primary level, must be strengthened. 3 strategic goals have been set in place to ensure that quality of education. Number 1. Improve equitable access and quality of education up to Year 8. Number 2. Improve the quality of training and education to address the needs of different students and their abilities. Number 3. Improve the administration of education so that the quality of education and performance increases. To improve the quality of education in Tonga, the Ministry has set up a Quality and Assurance Control Office, which monitors improvements in education through the Minimum Service Standards for Schools. The MSS sets standards for schools to meet, for example, teaching methods, student achievements, learning environments, and teaching and management capacity. In 2010, the FTIA raised the following concerns. Number 1, that teachers were not properly equipped to use technology in the classroom. Number 2, that the reoccurring assessment of teachers is not matched by proper training if shortfalls are identified. Number 3, inadequate mechanisms to encourage school dropouts to return to school. Number 4, lack of in-service training programs for teachers to keep abreast of professional development. Almost everyone older than 10 years of age was literate in Tonga. Challenges are identified beyond primary education. In particular, equitable access to quality education in the secondary and the link between educational outcomes and employment. Goal number 3, promote gender equality and empower women. 3A. Reduce by 2/3 the under 5 mortality rate between 1990 and 2015. Scorecard. Target is on track. Girls have equal access to scholarships to further their education, and they are committed to their own success. Tonga is hence on track to meeting the target of gender equality in terms of educational attainment. While the numbers of females in formal employment has increased, there has been little significant change in the type of occupation held. Tongan women and girls have excellent performance in educational attainment. As for female representation in the parliament, although there are no barriers to enter the parliament, there was only 1 female member in 2010. A petition of more than 700 signatures was presented by the male and female gender advocates. Goal number 4. Reduce gender mortality. Scorecard. Target 4A. Eliminate gender disparity in primary and secondary education, preferably by 2015, and in all levels of education no later than 2015. The target is on track. The under 5 mortality rate has fluctuated within the 1990-2008 period, with a lower rate seen in 2006 at 16.4 per 1,000, and upwards again
to 26 per 1,000 in 2008. Overall, the rate is far lower than seen elsewhere. The immunization program is very strong in Tonga and has enabled wide gains in reducing vaccine-preventable diseases. Globally, the leading cause of death in children under 5 were infectious diseases. In Tonga, a Lancet study reports a total of 56 deaths under 5 years of age, 25 cases in the 0 to 27 days age group, and 31 in the 1 to 59 months group. Goal number 5, improve maternal health. Scorecard, Target 5A, reduced by 3/4 the maternal mortality ratio between 1990 and 2015. Target is on track.
In terms of births attended by the skilled health personnel, Tonga does remarkably well at providing quality care and sustaining coverage as evidenced from high rates from 1999 onwards and 98% in 2007. Maternal morbidity remains a challenge, in particular with increases in gestational diabetes, a pregnancy-induced hypertension. The government of Tonga made priority of including maternal and child health programs which provide consistency and sustainability over the years. In Tonga, it is difficult to quantify the demand for family planning. Abortion may be illegal in Tonga, but is permitted to save the life of the mother if necessary. Goal number 6. Combat HIV, AIDS, TB, and other non-communicable diseases. Target 6A, have halted by 2015 and begun to reverse the spread of HIV/AIDS. The prevalence and incidence of HIV continue to remain low in Tonga. However, it's been reported that only 36% of young women and men from ages 15 to 24 display a correct knowledge of safe sex and HIV/AIDS. Tonga is involved in HIV prevention through a number of regional initiatives. Scorecard, Target is on track. Target 6B, achieve by 2010 universal access to treatment for HIV/AIDS for all those who need it. Scorecard, Target is on track. Target 6C, have halted by 2015 and begun to reverse the incidence of TB. Have reduced the prevalence of non-communicable disease. The prevalence of tuberculosis has greatly diminished from 53.7 per 100,000 in 1990 to 34 per 100,000 in 2007. The decline has been consistent over the years. Tonga has achieved remarkable cure rates under its TB control program. Target 6C, reduce the incidence of non-communicable diseases. Scorecard, Target is off track. Tonga has one of the highest rates of diabetes around the world and is ranked as one of the top countries for diabetes prevalence. Diabetes in Tonga remains largely undiagnosed. Support, partnership with the Government of Australia, called the Tonga Australia Partnership for Development, support progress towards poverty reduction and improvement in living standards for Tongans through improved health outcomes. Stronger awareness of sexually transmitted diseases must be raised within the younger age groups, including life skills for empowerment and prevention. Goal 7, ensure environmental sustainability. Target 7A, integrate the principles of sustainable development into countries' policies and programs to reverse the loss of environmental resources. Scorecard, Target is generally on track. 7A, trends in the progress of environmental sustainability. Tonga has been monitoring forests with the exclusion of coconut trees. The total forested area has been estimated at 4,000 hectares. 7B, reduce biodiversity loss, achieving by 2010 a significant reduction in the rate of the loss. Scorecard, data gaps but target generally on track. Marine biodiversity and resources are yet to be fully surveyed and documented. There's been a loss of inshore biodiversity due to easy access to coastal populations. Since 1976, only 5 marine parks have been established. Human activity has obvious consequences on the quality of the environment as evidenced by air pollution and the increased use of fossil fuel, inadequate disposal of solid waste, pesticide and fertilizer runoff in the groundwater and sea. Water pollution in Tonga is becoming an increasing problem. Target 7C. By 2015, the proportion of people without sustainable access to safe drinking water and basic sanitation. Scorecard, Target on track. Access to an improved water source refers to a reasonable access to an adequate amount of water from an improved source, such as household connection. Challenges. Although most Tongan households collect rainwater, the increasing contamination of groundwater is an increasing concern. Target 7D. The way forward. While there are some serious efforts in place to address the challenges posed by the environment and interrelation with human activity, many challenges will still remain.
The implementation of the policies and legislation will be the key in sustaining efforts towards environmental sustainability.
Goal number 8. Develop a global partnership for development. Scorecard. Target is on track. 8A.1. Trends of progress on the Global Partnership for Development. In accordance with the Paris Declaration on Aid Effectiveness, most of Tonga's development partners have begun to unite their ODA to the Kingdom. Tonga has also seen a significant increase in united aid in the last 2 years. In addition, the Asian Development Bank has provided a program grant, and Tonga is in the process of signing a similar grant with the World Bank. Tonga has made tremendous strides in the last 5 years in terms of its relationships with development partners. Under these agreements, Tonga receives 10% additional aids from Australia based on good government targets. It is important to keep in mind the purpose of aid, which is to contribute to the growth of lesser developed countries. In this regard, the MDG is sustained not only by the size of aid, but also its effectiveness. While aid effectively supports funding of essential social services such as health and education, many donors are involved in many different activities. The coordination is essential for the purpose of accountability and effectiveness. This has been increasingly addressed through the medium-term strategies and strategies for development. Target AC. Address the special needs of small island developing states. Scorecard. Slightly off track. Indicators under this particular target signal that further efforts need to be made to try and capture the effectiveness of ODA from the angle of special needs of small island developing states, and in particular in terms of open market access. Deal comprehensively with the debt problems of developing countries through national and international measures in order to make debt sustainable in the long term. Scorecard. Target is on track. The government of Tonga clearly followed this policy recommendation when it signed up to its latest roads loan as this concessional rate with a 5-year grace period on repayment. Therefore, the government of Tonga fell with 5 years to recover from the current crisis and to bring debt levels back to the sustainable target goal. Target 8E. In cooperation with pharmaceutical companies, provide access to affordable essential drugs in developing countries. Scorecard. Target is on track. Access to essential drugs is measured as the proportion of the population with sustainable access to the 20 most essential drugs identified by the World Health Organization. The Tongan population has access to free healthcare and drugs. Tonga is considered to achieve this target. Target 8F. In cooperation with the private sector, make available the benefits of new technologies, especially information and communication. Scorecard. Target is on track. Nearly a quarter of the population in Tonga has access to a fixed phone line in 2008, roughly a 5-fold increase from 1990 over an 18-year period. In addition, the increase in cellular subscribers rose dramatically in the past 5 years. The percentage of internet users increased from 1.8% of the households in 2003 and to 8.4% in 2007, but this is still low by international standards. Tonga, in conjunction with the Asian Development Bank and the World Bank, is in the process of signing up a new project for fiber optic cable either from Fiji or New Zealand. Key challenges: underutilized resources, pricing issues, dependent on the grade of the students, not everyone uses them, mainly email access and social networking, and the hobby of the person, for example, government ministries posting reports. A fiber optic cable will address these concerns.